Assalamu alaikum. I am Eman Moin and my topic of presentation is amikacin. Amikacin is a broad spectrum aminoglycoside antibiotic which interferes with translational initiation complex and misreading of mRNA, thereby checking the protein synthesis and resulting in bactericidal effect. This agent is used in treatment of serious infections due to gram-negative bacteria. The amikacin is indicated in treatment of serious bacterial infections, including Pseudomonas species, E. coli, species of indole positive and indole negative proteus, etc. Amikacin sulfate injection is effective in septicemia, in serious infections of the respiratory tract, bones and joints, central nervous system, and urinary tract infections. The main side effects of amikacin include neurotoxicity, ototoxicity, hypertension, hypersensitivity, anaphylaxis, etc. Dose adjustment. Dose adjustment should be done due to suspected renal dysfunction and frequent monitoring is recommended. Discontinue the drug or adjust the dose if there are signs or symptoms of ototoxicity. Mechanism of action. Amikacin binds to bactericidal 30S ribosomal subunits and leads to disruption of normal protein synthesis and production of non-functional or toxic peptides. Amikacin are generally bactericidal against gram-positive and gram-negative bacteria. 3 alternate brands. Amifade by Candid Pharmaceuticals is the cheapest option with respect to the pharmacoeconomic point of view. Ciprofloxacin and nitrofurantoin are the two alternatives for amikacin. Ciprofloxacin is indicated for anthrax, anthrax prophylaxis, and nitrofurantoin is prescribed for urinary tract infections. Amikacin has drug interactions with atracurium, bacitracin, neomycin, bumetanide, etc. Irrational use of drug. The global surge in aminoglycoside-resistant lactic acid bacteria may be a risk to human health, as the presence of one aminoglycoside resistance gene renders the bacteria tolerant to almost all antibiotics of the same class, thereby challenging its therapeutic efficacy. However, use of aminoglycosides in sublethal concentrations can trigger the selection and conjugal transfer of aminoglycoside resistance in probiotic (LAB). Case study. A 47-year-old teacher from urban background visited to the medicine outpatient department of a university hospital. On presentation, he complained of fever, burning micturition, and abdomen pain which was sudden and persisted for last few days. On examination, patient was febrile, dehydrated, complaints of burning micturition, suprapubic tenderness, and 3 to 5 episodes of loose stools and vomiting. Past medical history revealed that over the last 3 years, patient was on insulin mixtard for type 2 diabetes mellitus. A provisional diagnosis of type 2 diabetes mellitus with urinary tract infection was considered, and patient was started with tablet paracetamol 650 mg, injection ondansetron 4 mg 3 times a day, resiquadriol 100 mg, amikacin 500 mg twice a day, and insulin actrapid 15-15-0 and insulin mixtard 00-15. All his laboratory values were within the normal limit except a slight elevation of random blood sugar 218 mg per dl. On the fourth day of hospitalization, patient complains of giddiness, vertigo, and hearing difficulty. On examination, he was drowsy and complains of positional nystagmus. As these are the new symptoms, the physician requested for ophthalmic and neurologic consultation to rule out the other cause and was insignificant, but the audiometry report shows bilateral minimum hearing loss. Subject: age 47 years, gender male, chief complaint burning micturition, suprapubic tenderness, 3 to 5 episodes of loose stools and vomiting, abdomen pain which was sudden and persisted for last few days, medical history. Over the last 3 years, patient was on insulin mixtard for type 2 diabetes mellitus. Object: Patient was started with tablet paracetamol 650 mg, injection on Citron 400 mg 3 times a day, resicodotril 100 mg, amikacin 500 mg twice a day, and insulin ectrabit 15-15-0 and insulin mixtard 0015. All his laboratory values were within the normal limit except a slight elevation of random blood sugar 218 mg per dl. Assessment. Amikacin is a suspected agent and is discontinued. Common symptoms of amikacin are giddiness, nystagmus, etc., which are observed in our patient. The patient also has bilateral hearing impairment, which indicates toward aminoglycoside-induced hearing impairment. Plan. Ciprofloxacin 500 mg twice daily was started as alternative antibiotic choice for his UTI. The patient was put on symptomatic theory of injection thiamine, beta-histine 10 mg, and cinnarizine 25 mg OD. The symptoms like giddiness, vertigo, and nystagmus were resolved within 42 hours. However, patients still complains of minimum hearing loss. Thank you.